I want to thank Admiral Fanning for putting this together. A lot of work, and to all of you in the panel for your participation and personal courage in sharing your stories and experiences. I'm actually more moved than I thought I would be as I get up here to talk about this. Perhaps much to the dismay of the good secretary here, who's tried to train me over the years to be a good general. He's failed. And I kind of lack a certain containment about this because I'm very, very disappointed in the leadership. And I feel that the leadership missed the diagnosis years ago for what was happening to young soldiers like your son and to a number of others. They're just perhaps coming to it. But for those of us who went through the Vietnam era, I am very, very cynical that the right thing's going to get done. I wrote an article that got published in The Hill a couple months ago that said what we're going to see is Agent Orange deja vu. I think we've got an epidemic here. And I think hundreds of thousands of men and women who the 2.5 million have served in Iraq and Afghanistan, take 20–40% of them, I think, have been hit. And I think we are not giving them the treatment that they deserve. And so the responsibility rests with all of us here. This is another time for a grassroots movement. For all of us who care about those soldiers and Marines and sailors and airmen who've defended our freedoms, given us what we believe in with so much conviction. It's time for us to stand up, and it's got to come from our voice, and we've got to do it. We've got to do it loud. And we can't necessarily just wait to do it through the usual institutions. Now, these are complex patients, and I don't think that Sergeant Somm would mind me telling his story, because it is indicative, sort of like it is for your side. The irony is, the reason I say that I think the diagnosis was missed is we've seen this before. In 1970, I was a patient on Ward 1 at Walter Reed that was the amputee ward. And I was there at a time when in fact the rehab was very, very hard. I went to med school after that and ended up doing internship residency at Letterman, and we saw the first group of guys coming back from Vietnam and treated them. Their stories are, as you know, as heartbreaking as these. We should have learned and embedded those lessons in our professional practice. Bo Somm is a 34-year-old former sergeant, did 2 tours in Iraq, got hit by multiple IEDs, worked as a medic on one tour, worked as a special operator on another tour, came back, got out, and his life fell apart. And when he got to us through personal relationships, he was a severe alcoholic. It's probably what he was going to end up dying of, was his alcoholism. And like a lot of young men and women who find their lives just spiraling down, it's not far from waking up one morning and say, you know, if someone else isn't going to take my life, I'm going to do it. And it's just an instant, and everything stops cold. So when he got to us, we saw the alcoholism, we saw the sleep problems, we saw the pain, we saw the anxiety and the depression. And with the great advice and counsel also of my partner, Dr. Mosiani, we set about to put him on we thought was going to be a recuperative pathway. The first step for us was the hyperbarics, because it was the only treatment we have that in any way heals these injured brains. And we couldn't detox him from his alcohol and make sure he stayed off of it, and then maybe get him into school and education unless his brain was working. It didn't fix his life. But it is what we have available now, and the best, absolutely the best therapy we have available. Getting the brain in shape so that you can do all the other things that need to be done. So he went through 40 sessions. After that, we sent him out to a 4-month detox rehab program. He's gone through that. We have also some other treatments for sleep and anxiety, and he is, as you will see, and we'll see in the video, a functioning and productive, really nice young man. 2 weeks ago, and I will end with this, he referred another young man to us, 22 years old. This soldier was with the 101st Airborne. 4 months after he arrived in Afghanistan, IED blast, lost his left leg below the knee, severely injured his right leg and his left hand. Got air vac back, all the best treatments, got, the $50,000 prosthesis at Walter Reed. And I said, so, blast took off your leg. What did they do about did they ask you about how you were doing, how you were thinking? They said, well, they didn't really, this was 2010 now. Well, they did an MRI, didn't show anything. Did anything else occur? Did they test you in any other way? Did they offer you any other therapy? He says, I told them I can't think. I told them I can't remember. I can't concentrate. But they said, you probably don't have a blast. Go see the psychiatrist. I didn't like the psychiatrist. So here I am. That shouldn't happen. But it's going to happen. And I think that what we can do is raise up our voice now, come together, and I really thank, again, the league here, and say, well, there's other folks, there are other people out there, and we're glad to take them, and we're glad to help them in the best that we can.